All right, get ready for a breakthrough, a smile breakthrough, thanks to the power of implants. Dr. Charles Martin joins us this morning. Good morning, sir.
Good morning.
Thanks for joining us. We're going to talk breakthroughs here.
Right.
And smile breakthroughs,
That's
more
right.
importantly, which is what you specialize in.
Right.
What are some of the new breakthroughs in dental implants nowadays?
Well, you know, I've been doing implants since 1983, and implants are literally a third set of teeth that you can have that prevent problems of removable teeth that everybody knows cause bone loss, wrinkles, premature aging, change in nutrition. What's new with implants is what we're able to do when we didn't have bone before. Now we're able to put implants into areas where there's very little bone using new technology that allows us to actually build bone back up, and in some cases make it grow vertically, which we've had a hard time doing in the past, and widening bone before that was too skinny, too narrow, and too small. So the big change.
A lot more options now.
Yeah, there's a lot more options. And so for the person's been told, you don't have enough bone to have implants, or you can't have implants. That's not true anymore.
All right. Then obviously that opens up an area for a lot of folks that had been turned away before.
That's right.
And this technology, you said you started in the 80s, obviously changed a little bit.
It's changed enormously.
It's just in the last couple of years.
Oh, it changed enormously. And what we're now doing with human growth factors, we're actually taking the growth factors from the individual person themselves, and now placing it within the context of the bone on the implants and accelerating growth, accelerating bone, accelerating integration of the implant into the bone.
So you actually grow the bone?
Yeah.
Wow.
Yeah, that's different. That's different.
Never thought about anything like that.
Yeah.
Let's talk about mistakes that people can make when they're looking at implants, because judging from my past history, I've been known to find a mistake if there's one to make. So let's get that stopped before we go there.
Well, first of all, you know, the problem that mistakes people make with implants is trying to get too few implants to fix the problem. I have a whole mess of missing teeth, whole big area, and say, can you put one implant back there and build teeth on it? Well, no. You know, you have to have, generally the rule of thumb is somewhere close to one implant per missing tooth. Not exactly that way. Depends on the density of bone. So that's one mistake, is trying to do too little with the number of implants. The second one is trying to do too little with putting things back together again. If a person has a problem where they've had missing teeth, there was a reason they had missing teeth. And if you're going to put implants back, you better make sure that whatever caused the mistake to happen in the first place isn't still there.
What would that be?
Well, two things. One is gum disease that's not treated.
Okay.
And so that can cause a problem with the remaining teeth, and even cause a problem with the implants if that's not treated, because you get literally peri-implant disease. The second one, and a very major one, is with the bite. Because while everybody is aware of gum disease being a problem, tooth decay being a problem, they're not aware of this third thing over here, which is the bite, what we call occlusion, or how things come together. Literally the whole chewing mechanism. So if that's not correct, it'll cause things to fail.
All right. Can I take a look at some of these before and afters
Absolutely.
that you always bring?
Yep.
Wow.
Yeah, big change.
Sometimes it's a little subtle. Sometimes
this isn't so subtle.
This one is a big difference.
This is a big difference, and you can certainly see how much happier. You know, what's interesting is just the change in the smile.
Yeah.
Yeah, and you know, when your teeth don't look as good as you want them to, you don't smile the same.
Eyes are even lit up more.
Eyes are even lit up. Yeah. They sparkle more the other way. That's
Thank
right.
you, Dr. Martin.
Thank
Folks,
you.